Hello everyone, I'm making a new treatment plan and decided to get back to recording some of my work, some of my interesting cases I do. And here we have midline shift, upper jaw, and midline on the upper jaw is shifted a bit to the left. So we are going to try to improve the midlines by moving the incisors to the right. And but before we diving into the setup, I want to show you something. This is my website I've made just yesterday. It's called Setup Hub, and it's like a marketplace for dental technicians working for orthodontics. And yeah, people are registering here. So if you are the orthodontist who makes virtual treatment plans, please register here. And my idea is to attract more clients, so that like it's like a marketplace. So people come here to find a dental technician, and the dental technicians, they offer their services, and they show the prices and stuff. So please register here, and I will be glad to see you on my website. Well, let's proceed with the setup. And as usually, we start with checking the axis. Here, we're going to do distalization. That's why we set the axis of the teeth this way, like we don't look at the roots, because we're going to do like it's as a bodily movement. So that's why we look only at the crown's anatomy and position the virtual roots this way. But for the other teeth, like for incisors, for canines, we do it as we normally do, because we're going to do both movements, like tipping and also translation. And let's check the lower jaw. This is very, very important. It's always to start with that. So my dental technicians, they did some preparations, they do segmentation, they do VCT superposition, and then they send me this file in M3D format for Maestro, and I check the roots. But it doesn't matter in what software you work. The protocols, the biomechanics is the same. It's just an interface you work in. But the principles, they are similar everywhere. That's it. So for the posterior teeth, I also put the roots this way, not looking at the roots, just looking at the crowns, because we're going to just expand and maybe do some slight rotations. And after we set the roots, we go to the virtual planing module, and here I think my strategy is going to be some distalization on the upper jaw, but obviously cannot distillate it that much to achieve class 1. And even if we do, like it's a very simple test, right? Like we can do it like this, put it to class 1, and obviously we're not going to move the teeth like that. So for sure we will distalize for some degree, to some degree, maybe to 2 millimeters, and try to advance the mandible, the lower jaw, because we're going to ask the patient to wear elastics, which will serve us for two purposes, for anchorage, for distalization, and also for advancement of the mandible. So let's start. We do our standard distalization protocol. So let's do it for like halfway. We'd also do some rotation. We do some, I'll usually combine tipping and bodily movement. And at the same time, we can start working with the incisors, slightly moving them forward. And here, also going to expand. Look, I use only 3 movements because it's like way more realistic. Then we make a second layer and we put the second molar into the final position. And we start working with the first molar, moving halfway, and proceed with working with the incisors. Always need space, so we start making, it's like creating space right from the start. And layer 3. So here we go. And now we put the first molar to the final position and start working with the second premolar. Here, look, I combine, because if we look at the roots, they are relatively long, so I don't expect to have pure translational movements here. They will be combined with tipping. Even if we do pure translation, we will get tipping anyway, so reduce the chance of, unwanted movements, chance of refinements. We need to think about the consequences and to be more realistic at our planning. So that's why I combine those movements. I think I've made too much, but we'll check it later. Right here, so add some expansion, and now we're finally positioning the first premolar at its place here, close to the second premolar. Now we start working with the canine. We'll try to make it more bodily. Okay. Look, why I use some intrusion, because if we move in the canine bodily with these arrows, it also goes, you see, it also goes vertically down. So that's why we have two options: either do it like this and intrude, or you just use the keyboard and move it with like arrows on the keyboard, and it's gonna be moving in one plane, in one horizontal plane, if we look at it in this way. So here we go. We don't move more than 2 teeth at the same time, even with having anchorage. We'll talk about it later. Because the patient has to wear elastics since the very first step. But even with the elastics, we cannot move more than 2 teeth at the same time towards the same direction. So here we go, and we're going to move the incisors using bodily movements. Yeah, I think I've done too much with the distalization. We will work on it. So if I realize that I did it too much, we just go back to the layer 1 and we reduce the amount of movement. Then we reduce the amount of movement of the first molar. Then we choose this 3 teeth, the layer 3. We click Restore as previous layer. So putting it here. Moving the second premolar here. Now we're choosing the 4 of this teeth. Final position here. Halfway here. Layer 5. Final position here. Halfway of the canine. Yes. And layer 6. Final position for the canine. And start working with the incisors. I hope you get it how I did it. And then we work with 2 incisors at the same time, not 3. We always need anchorage. I mean, we can move the teeth to the palatal side, but not to the mesodistal. Like we cannot move 3 teeth at the same time towards the same direction, like this way, because there will be no anchorage and they will just not move. Or we can get some side effects, and instead of having this teeth moving to the right, can get opposite teeth moving to the left. That's what we don't want. So layer 7. Here we should finish the mesodistal movements for the second lateral incisor. Layer 8. And we're moving the 1 tooth, both nasally and palatally. And layer 9. And just recline all the teeth. Finally combine retraction and inclination. Now we see that we don't want to use that much of inclination. That's why, guys, that's why we use CBCT scans for every case. So let's erase the layer 9, get back to layer 8. And at layer 9, I'm going to use only the translational movements. And to make them work, if we do retraction, bodily retraction, we also need to add intrusion. This is the only way to make this work, to combine the bodily movements towards the palatal direction and the intrusion. There are some studies which proving that rule. So we still need some IPR here. Let's make the final adjustments. Yeah, we may need some IPR here. Or just don't recline that much. This is also an option. Yeah, we can lift the teeth a little bit more forward and just reduce the movement here. Yeah, something like that. And now the second part is working with the overture. Here it's much more simple. Like, look guys, if there are like small rotations, we never do anything to that. Like, because there is 99% of relapse if you try to fix those minor rotations, because it's made by nature to chew to, you know, this is a very stable occlusion, and if we do those changes, have high chance of relapse. I mean, with clear aligners. With other techniques, there are other possible outcomes, but here, I mean, if you're trying to fix this rotation, not sure it's gonna be stable. And the most important is that there's just no sense at from the aesthetical point of view. So here is I always do. I do those the round tripping, and I think we can work with the occlusal plane and do some intrusion of the canines. We cannot intrude the canines and the incisors at the same layer, so we will we'll intrude the canines as much as we can in layer 1. And in the second layer, we will work with the incisors, because we also need anchorage for intrusion. We'll put 4 attachments on every premolar, put an attachment to make this anchorage, and do something else I'll show you later. So now we're finalizing the positions of the incisors, checking if we need some overcorrection. We always need it. Just we need to find out where exactly should we overcorrect. I'm always checking, I'm comparing the initial position of the teeth and the final layer. Check out where we need overcorrection. And yeah, let's make some intrusion for the lower incisors. And at the same time, through the premolars. This is also the reason why I set the axis this way. But I also use the keyboard, or we can use just the arrow. Well, so my idea is that, let me show you, we can make this demonstrational layer. We choose all the lower teeth, and see what will happen. Don't look at the roots. My idea is that lower jaw will shift a little bit to the right, and we're gonna get this kind of contacts. So that's why we need to make some sagittal gap. Okay, we can increase the amount of distalization here. Surely, but why wouldn't I do that? Is because I don't think that we can move the incisors bodily to that much. Look, if we make, let me some extra layer. I don't know how to do that. I mean, the thing is that if we get too much space, we cannot, move the incisors using just bodily movements as much as we can, because they will tip anyway, and we're gonna get something like that, like, which is not cool. So I'm choosing not to distalize that much, keep some asymmetry, keep some class 2-ish, but I'm gonna be I think it's gonna be better in terms of aesthetics and stability. So now let's work with the attachments, and we can start with the lower jaw. Like, since we need an anchorage for intrusion, we put these attachments on the premolars, and they will also help us to extrude the premolars. Yeah, can copy and paste to the opposite side. Always opt for 90 degrees angle to the surface of the premolars and attachment. So I just look and check. It's close to 90 degrees, I think. Yeah, it's good. We also need some attachments on the first molars, because we're going to make buttons, bond buttons onto the surface of this teeth, and we will indicate the places for the buttons by putting two negative attachments here and there, so the technician will cut the liner in this area. Do we need any attachments on the frontal teeth? No, we don't. We don't have any noticeable rotations on the canines, and for the incisors, we don't need them either. So we just set available layers and proceed with the attachments on the upper jaw. Here I use my standard attachments shape for the stylization. 110 degrees. And here we're going to make a cutout or a button onto the surface of the liner, the anchorage. There. How we do that. And here we need to put the attachments required for the success of translational movements. So we can. We don't know what we do can. Right. So this one is used for putting pressure closer to the root, and the opposite one is here to prevent tipping. So we put them here the same way, because we're moving all the teeth from right to the left. Should we put these attachments from the first step? I don't think so. I think we'll want them later at like they're 6 or 7. Let's check it later. And here we haven't done any distillation, so we need just the attachments for anchorage, and we'll use some standard attachments which will just help us to hold the aligner onto the surface of the teeth. And yeah, I save the progress from time to time because software can crash. Sometimes it happens, but really rarely, but it does happen. And we don't want to lose the progress. Yeah, we should not forget about numbering. That's it. And let's set it for all the layers. And now let's see, do we need those? Yeah, I think we start moving the incisors to the right at layer 6. So from layer 1 to layer 5, we just don't need those attachments. No. Okay. Attachments. Okay. I think I have to do it manually. Was not a good idea. I should just have made them at layer 6 and not doing this shit I'm doing now, but anyway, I'm gonna waste 1 minute manually erasing those attachments from the surface of the incisors, and there we go. They appeared. Okay, let's bond all the attachments at layer 6. Because it's gonna be more precise. And I think we don't need them anymore at layer 9, so we can just erase them as well. That's it. There's another trick I want to show you. I use this trick for the last 2 or 3 years. Like, since we have an accumulation of errors for every aligner, I increase the size of the attachments, which doesn't mean we need to bond new attachments, but it means that even if the fit is not that tight, is not as accurate as it was at the beginning, we make some extra room for the attachments to feed the tray. That's why we help, but that's why how we fight the accumulation, the errors. Look, like, my goal is always to prevent us from the refinements. That's it. And I forgot about one more thing, about indication of the buttons on the upper jaw. So let me do that. We're going to use this shape. Okay, we're starting with layer 1. At layer 1 we put indications. I'm gonna that. So it means we make a cutout here, or, which is much better, we make a button. We just take some special pliers and make a button here, form a button. Like, this is the way we cut the aligner. So this is the plastic. We take the pliers and we make a button here. So it will look like that. There's going to be this kind of button. There are special pliers or other techniques which you can also use. So here, doing it all wrong. I mean, I shouldn't have left it for the final. I mean, have postponed the positioning, putting the attachments, but anyway. So it's canine. Okay, and here we're starting to move the canine, and that's why we are going to put buttons here. And since we're starting to work with the canines directly, we, like before, we used to wear the elastics, to attach elastics to the surface of the aligner to make more anchorage, but here we need more, provide more body movements for the canines. So we put the elastics onto the canines surfaces. I think we can even, get rid of the attachments. Yeah, it looks a little bit complicated, but if you understand the logic, it's not that difficult anymore. And now, final part, we're going to calculate how many steps do we need. Well, here we do 4, and here we do 4. Yeah, not many movements, so we don't need many aligners for the lower jaw. But with the upper, I think it's gonna be around 30. No, I think, yeah, a bit more, maybe up to 40, because we're moving the incisors at separate layers, and gonna be extra 10 something aligners. Okay, let's do 3. Let's do 2. Let's do 2 here. 3, 2, 3, 3, 5, 4. I think we can do 3 here. Yeah, I have my protocols, and that's why I am estimating it that quick. Yeah. If you attend my courses, I'll share you my protocols as well, with all the attachments and numbers and limitations and stuff. Let's see, it's so not that many aligners. And let's see the animation, how it looks. And then we're going to upload it into the cloud viewer and send to the clients. Well, check out the animation. And very interesting, haven't I missed anything with these attachments? Yeah, it's becoming bigger every step, every stage. Stylization and movements of the incisors. Looks good. And the lower jaw, it's more simple. Just some fight round tripping back and forth. Well, I'm going to upload this case into my web viewer. Let me show you some example. Like we upload all the cases through my web viewer. Create a case. You put the files from the software here, and then you get this link. So you can open it and you can put your logo type, put your colors, put your design, like it's customizable. And yeah, then you get this animation and show it to your clients. Look here at this setup, I also increased, look at the attachment. It's getting bigger and bigger to fight the accumulation of the errors, to reduce the refinements. And here, same thing. Well, thank you for watching, and yeah, I'll attach the link to the treatment plan so you can check it out in my viewer. You can also register in my viewer and use it. And yeah, sign up here on my website for technicians and add your portfolio, and you're gonna have like your personal page with your ID, so you can send it to your clients whom you work the setups for. Thank you guys. See you in next videos.